If you have a tight and painful hip flexor that just won't go away no matter what you do, this video is for you. I'm going to show you exactly why that keeps happening and the first 2 steps of a 4-step protocol that actually address the real source of the problem. So make sure you stay to the end. If you do those exercises right, you're going to feel more relief in 60 seconds than months of stretching ever give you. But if you do those wrong, you're going to make your pain significantly worse. And I've seen it happen more than 100 times. So make sure you're doing all those exercises 100% right, and make sure you stay to the end, because at the end, I'll tell you the common mistake as well. If you're new here, my name is Alvin. I have a master's degree in biomechanics in solid. Over the past 6 years, I've had over more than 400+ desk worker move, train again without their lower back pain. Now, I want to be super clear about this. There's no guarantee. If there's anyone tell you there's 100% guarantee you will be pain-free, they're either lying to you or not telling you the real work and risk involved. Now, all I do here is to help you avoid a mistake I made, share the tip from my past 400+ clients who already get out of their back pain, and give you the best shot at real and long-lasting relief. Now, let's break this down. Now, here's the truth about your hip flexors. It's not tight because it is short. It is tight because your nervous system is telling it to be tight. Your brain decided at some point that this area needed protecting. That might be from an old injury, maybe from years of sitting down, maybe from a movement pattern that's been loading your hip flexor around for a long time. And now your nervous system is running a protection program around it 24/7 to make sure, okay, we're not gonna move that part of the body, because when we move it wrong, you're gonna feel pain. And you can't stretch your way out of a nervous system issues. Now, you can stretch your hip flexor all day long, or you can make your hip flexor stronger all day long, but your muscle are just following the orders, okay? Your nervous system always wins. This is why stretching it feel good at the moment, but maybe 30 minutes later, you're back to where you started, because your muscle follow the order from your nervous system right here. So what actually works? Now, you have to give your nervous system better information, and that's exactly what this protocol does. A 4-step protocol, and each one targeting a different neurological layer. And today, I'm going to cover the first 2. Now, before we do anything, check in with yourself. Just stand up, do an active straight leg raise. All right, keep the leg straight up and lift up from the hip as high as possible. And I want you to notice 2 things. How far can you go? And do you feel any tightness or cramping around your hip joint? All right, remember that discomfort, and that is your baseline. You're going to come back to this after each drill and then retest to tell whether this drill is working for your specific body. Because here's the truth, not every drill works for every person, and your nervous system, your body is unique. Your brain responds to different input differently. So the assessment process is not optional. It's basically the whole game. All right, if your drill improve your straight leg raise, well, that's a really good sign that this might be a high payoff drill for you. So you keep it. Now, if your drill makes things worse, well, you want to stop it or leave it for now. But that is still super valuable information in a professional eye. All right, now the first drill is a joint mobilizations for the hip itself. Now, it sounds simple. It is not. All right, standing next to something you can hold on to for balance, maybe like a wall, maybe like a chair. Lock up your leg you're working on. Knee fully straight. Now, lift it slightly from the hip and begin tracing a circle. The motion is coming entirely from the hip joint, not the pelvis. And this is where most people go wrong immediately. They hike up their pelvis thinking they're moving their hip. And that is your pelvis compensating. This is not what we want. Your pelvis stay level. Your pelvis stay completely still. Your femur is a part that actually moves. Now, think about the ball of your hip joint drawing a circle. All right, that's it. Now, here's the key. If this feels easy, you're not doing this correctly. You're not working at the end range of your range of motions. I want you to really reach for the top of that circle. Contract your hip flexor hard to get there, and you should feel like strength training at the top. 3 to 5 slow control reps in each direction. Work at the end range the entire time. Now, if going to end range causes a lot of discomfort, you can use a smaller range of motion to start. And just after that, I want you to immediately retest your straight leg raise. Did it go higher? Did it feel easier? Did your pain scale drop? Mark what you find, and then we're gonna move on to the next one. Now, the reason why this works is because our brain have a map of every joint, every muscle, every ligament inside of our body. And when your brain lose a clear map of that joint specifically, it's going to restrict the movement around that joint to protect it. Now, that is called proprioceptive map, and is one of the most overlooked reasons why hip flexors stay locked up. By moving the hip through its full range of motion with control and intention, you're sending your brain right here clear information about where that joint is in space. And when your brain gets clear information, it loosens up the grip automatically. Movement become more available and pain start to back it off. And that is a local layer. All right, now let's go one layer deeper. And this is where things start to get a lot more interesting. Now, the femoral nerve is the nerve that that directly supply your hip flexor. It controls how well those muscles fired up. And when that nerve loses its ability to glide freely, your hip flexor can't fire properly. They're gonna feel weak, they're gonna feel tight, they're gonna feel unstable. And no amount of stretching or strengthening can fix a nerve that cannot move properly. So we're going to mobilize your nerve. Now get into a half kneeling position. Kneeling on the side you're working on. And if you have something to elevate your back knee, use it, all right? If not, completely fine. Just stay flat. Just make sure you're kneeling on something soft. Step number 1, I want you to tuck your tailbone. So kind of feel like you're doing a posterior pelvic tilt around your pelvis. Think about pulling your belt buckle up towards your forehead and just a subtle tuck. I want you to hold it there. Now, step number 2, come forward into a little more hip extension. Now, keeping the pelvic tuck. Shift your weight forward so the side of the kneeling leg moves slightly backward. Now, hold both of this position together. Number 3, listen up tall. And number 4, slowly run your upper back forward. Keep the lower body position locking as you go. As you run forward, you're going to feel something different from a regular hip flexor stretch. You're gonna feel it's broader, it radiates, it moves through the front of the side and sometimes slightly inward toward the inside of your leg. And that's your femoral nerve under tension. And the rule here is the same as any nerve work, only 3 out of 10. All right, your nerve do not respond well to aggressive loading. Now, this is not a hip flexor stretch. We're not trying to chase the stretch sensation. We're just trying to get your body in this position. So we're loading your nerve and you just need to hold it there. That's it. You don't have to feel anything too aggressive at all. Now, I want you to drive the mobilization from the hip. Now, you can do the way I like it, just going back and forth a little bit. Contract your glutes slightly to move a little bit forward and then release and come back. Or you can do a more controlled manner. You want to do a small circle from the hip, a little more complex, but more effective. And pick whichever feel more natural to you. About 8 to 10 reps. Again, only 3 out of 10 the entire time. Don't hold your breath. Now, get out of the ground and then immediately retest your straight leg raise. Did it go higher? Do you feel looser? Do you feel like your pain scale drop? All right, we're gonna mark your finding right there. And this is just one part of the loop. Now, I want you to zoom out a little bit and I want you to put this into context because this matters. Now, your hip flexor is not a random isolated problem. It's a symptom of a loop that's been running around in your body, a structural imbalance that's overloading the wrong muscle every single day. A nervous system locked into the protection program around the imbalance. And your balance system, your vestibular system that has been recalibrating around your broken movement pattern. And on top of all that, a vision system compensating because your wrong movement pattern. And every layer feeds the next one. And as long as you even have one layer still running, the tightness keeps coming back. Now, those two drills address the local layer and the nerve layer. Both are super important. But if the deeper layer are still running underneath it, now the relief won't last long because you need to fix everything all together in the right sequence to make sure not only you can feel relief, but also you can maintain this for a long period of time. All right, if you haven't already, make sure to subscribe because I'm going to drop part 2 in the next week. Hope you guys enjoyed this video and I'll see you guys next time.